بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. My topic today is presenting some abdominal cases. 3 to 4 cases, and we will see some cases in the brain films. The first case is a patient with presented with right upper quadrant pain radiating to the back. And here, this is the abdominal X-ray patient. What is the finding? As we see here, in the right upper quadrant, there is curvilinear radiolucent line surrounding the gallbladder region, and we call it, this is emphysematous cholecystitis, and this, it is caused by infection and can be associated with stone or without stone, and it is also associated with diabetes, and we can also diagnose it on ultrasound and CT scan. So this is a crucial finding. It is emphysematous cholecystitis with infection with gas-forming organism, and there is some degenerative disc disease changes involving the dorsal spine with calcification in the pelvis. Second case, a patient presented to the emergency department with vague abdominal pain, and this is the plain abdomen concentrating on the right upper quadrant. What do you think you see here in this spot film abdominal X-ray? We see here in the right upper quadrant curvilinear calcification in the right upper quadrant, and we call this calcification, it is a porcelain, and it is involving the gallbladder, and this calcification, it is associated with stones and associated with malignancy. Can be the patient asymptomatic. But recent studies said that the association with gallbladder, porcelain gallbladder, and adenocarcinoma is a weak association, and especially in patients with diffuse calcification, and there is no risk of cancer. This is the new studies. We don't know it is true or it is not, but the classic teaching, it is associated with cancer. The third case here is a patient with chronic abdominal pain and he has history of alcohol abuse. As we see in the spot X-ray of the upper abdomen, a multiple cause classification involving the mid-upper abdomen going to the left side in the anatomic location of the pancreas. And this is consistent with chronic pancreatitis with calcification in the pancreatic duct. And in this patient with long-standing alcohol abuse, and it is a most common cause of this chronic pancreatitis with calcification uh, due to alcohol. It accounts more than 70% of cases. So this is a calcification in the pancreatic duct with patient with chronic pancreatitis. Here another patient with history of repeated urinary tract infection presented with renal colic. As we see here, the spot view for the upper abdomen, including the kidneys, as we see here, multiple calcification involving both kidneys. On the right side has the shape of the cervical system, uh, and we call this staghorn calculi. And on the left side, it is involved 1 to 2 calyx. Also, it is staghorn calculi. If it is involved more than 2 calyx, and about 75% of cases of staghorn calculi are due to struvite stones, and it is composed of struvite carbonate epithet matrix, and these typically developed from urease producing bacteria called ureaplasma and urealectum and Proteus species, and these stones don't pass spontaneously because they have a large size and they grow and should be removed surgically. Also, we see here there are degenerative disc disease changes involving the lumbar spine. So this is a classic staghorn calculi involving both kidneys larger on the right side. The last case, we patient with routine abdominal X-ray with long-standing abdominal pain. As we see here, there is cavilina calcification at the level of L4, L5 level on the right side. And on that calcification also on the lateral view we see this is the abdominal aorta and this calcification involving the distal abdominal aorta and above the bifurcation, and here this is the bifurcation and this is calcified aneurysm. And this is calcified aortic aneurysm above the bifurcation. For better evaluation of the aneurysm, we need CT and MRI, and ultrasound also may be helpful. What else we see on this lateral X-ray? We see there is a spondylolisthesis of L3 over L4 with decreased disc space. Also, we have seen the calcification of the iliac common iliac vessels with ectatic changes more on the right side. Thank you for listening. Hoping to see you in another talk.